cardiovascular medicine has evolved into a very complex process. So when a patient comes to us, they may have a different problem, whether it's an arrhythmia problem, it's a heart failure problem, or coronary arteries problem. That requires a different set of skills.
There's no physician that can do everything in this day and age. Each one of us has his own specialty, and we share these specialties. So we have a comprehensive coverage for cardiovascular issues.
A team approach, I think, comes in because we all have some of our little subspecialty interest areas. Some of the doctors are interventional, some do nuclear, some are general, some are doing pacemakers. So there's a lot of ability within the group to cover most of the aspects of cardiology.
In the office setting, you have people for scheduling, answering the phones. We have different avenues for renewing prescriptions. You have the nurses, the RNs, the LPNs. You have the physicians all working together to best satisfy and meet the patient's needs.
One of the new modalities that we offer is additional imaging during the cardiac catheterization. In the old days, cardiac cath would be just a dye-based study where you inject dye in the arteries and look for a blockage. And oftentimes you'll find a blockage, but it's not that bad. And in many instances, a patient will be told, well, you're not that sick, go home. Now, our interventional cardiologist, Dr. Sheldon, he can actually take special tools and advance them through the blockage and take additional measurements. And oftentimes a blockage that doesn't look that bad can actually be severe. And that there's, patients like that would be turned away sometimes, where now with that particular level of extra expertise, we can identify the patient's problem and fix it.
Somebody comes in with an acute myocardial infarction, a cardiology will see him and will arrange for his cardiac catheterization and an angioplasty. So there may be 2 or 3 cardiologists involved in the patient care, but everything develops smoothly because we have direct communication with each other and everything is done very expeditiously.
My specialty is invasive non-interventional cardiology, which means I do heart catheterizations, I do echoes, I do stress, I do general cardiology. I do not put pacemakers, I don't do defibrillators, I don't do surgeries, I don't do angioplasty. But we have other members of the team that do the rest of what I don't do.
Many of us not only do one cardiology fellowship, but do sometimes 2 cardiology fellowships. And for instance, myself, I trained in invasive cardiology, but I also do pacing and electrophysiology. So my particular area of expertise is what we call rhythm management.
I'm more general cardiology. I do implant pacemakers also, but general cardiology, heart caths, diagnostic heart caths.
If somebody needs a heart catheterization, there's always somebody to do it. If somebody needs a defibrillator, there's always somebody to do it. And there's always somebody available 24/7 to cover all subjects related to cardiovascular disease. So the patient can be assured that if they have any cardiac issues, no matter what, day and night, any day of the week or weekend, there's always somebody in the group who's available to take care of that patient and that particular problem. So they can be rest assured that they don't have to go anywhere else if they need to have any cardiac issues taken care of any time of the day or night.